So after discussing the how to we have to take the history, now come to the general physical examination. This is a very important part for your MBBS curriculum in practical examinations. That once we are taken the history, then the good general physical examination will give you a clue towards your probable clinical diagnosis. So in general physical examination, the first thing is that always take a consent from the patient that you are going to examine that patient. So like that, in that language which can patient understand. भाई हम आपके जनरल फिजिकल एग्जामिनेशन अभी करना चाहते हैं बच्चों को दिखाने के लिए, आपको कोई दिक्कत तो नहीं, आप तैयार हैं? So now this in that local language we always have to take the consent. After the consent, second thing is that we always take the general physical examination in a very good day, bright light, because once if that there will be some lights, then they can change the skin color and then the diagnosis may be changed. So it should be always in the good bright daylight. So now in this patient we'll start from head to toe, means from top to bottom we have to look at the patient. So there are some things initially starting with that. Once before going to general physical examination we have to take the vitals. So what are the vitals? Vitals are the your blood pressure, your pulse rate, your respiratory rate, your temperature, your saturation. And nowadays if you can take that blood sugar, because in increasing in India, then that is an option whether you want to take or not. But the 5 vitals are the blood pressure, pulse, respiratory rate, saturation and temperature. That's okay. After taking that, then just see the patient's the patient is whether conscious or oriented or not. So for that mental status you have to ask the name. Once you have taken in the history, then that will show you that patient is whether he is a conscious or not, whether he is oriented to time place person or not, whether patient can give the proper history and all. So starting from the head to toe, so look at the hairs. It is more common in the pediatric age group because there may be a patient with the microcephaly or the macrocephaly, or there may be a hydrocephalus. But in adult, there is not like that all these things. But if hydrocephalus develop, then that may be showed in that patient. So in this particular patient, just see the any deformity in the head. Now he is okay. Then see the graying of hairs. Here in that you can see that this patient is because more than 50 years of age. So this is the generalized graying of hairs, that is age related. Then look the eyes, look the ears, the eyebrows, the mustache, the general build patient, whether it is whether he is averagely built or malnourished or obese, because we know that all these can give you some clue about your diagnosis. If patient is obese, there then maybe a few metabolic syndromes including your hypertension, diabetes and all. If patient is malnourished or patient is starvated, then we can see the status of that patient, or that whether he is taking or not a proper diet. So after that, look at there are 6 things in general physical examination. For that we have to look there is a mnemonic also for that is a PICL. P for pallor, I for icterus, C for clubbing, C for cyanosis, L for lymphadenopathy and E for the edema. So by looking all these 6 things we can find out some diseases. So first and foremost is the pallor. What is pallor? Pallor is basically the paleness of the your skin or your sclera. Okay, so paleness is an indication of anemia. If there is a patient is having anemia, then we have to look for this pallor. Pallor can be seen at the your lower palpebral conjunctiva and your skin colors. So for that you have to ask the patient to look. Baba, ऊपर देखना है. You just नहीं आप ऊपर देखो. So this lower palpebral conjunctiva, you can see the paleness. Then you can see the skin colors. हाथ सीधे करो. So the skin color may show you that patient if anemic, then there will be decrease in hemoglobin. The paleness of there will be changes in skin. So that will give you answer of the patient is having anemia or not. So for icterus, we have to see the sclera. By seeing the sclera, you can see that if there is a jaundice, then sclera will be icterus will be present in the sclera. Icterus can be seen another on your hands. Okay, the sclera, the jaundice can be seen in the yellowish discoloration of skin tissue also. Then come to the clubbing. So clubbing is always being seen in your nails. So there are 4 grading of your clubbing. So you have to ask the patient for that clubbing. Baba ji, हाथ सीधे करो, हाथ ऐसे सीधे करो. So the first thing you can see in this particular patient, you just zoom on that. So there is a clubbing is present in this patient. This is the clubbing. Clubbing first for grade 1 you have to see just the fluctuation test. By you just ask patient to end, then adjoining skin you have to press this. If there is a fluctuation present, means there may be a clubbing also. But clubbing, if it is visible directly, that in this particular patient you can see that this is a clubbing grade 3 or 4. So by seeing the nail bed, you can see in third type of third grade of clubbing, there is a Shamrod sign, and in Shamrod sign, what you have to do, you have to just ask the patient and just do like that. बाबा जी, इनको ऐसे करो मेरी तरह, ऐसे, हाँ, इनको नीचे लो, ऐसे, ऐसे, हाँ, नहीं एक अंगुली को करना है, ऐसे. So there is this angle is obtuse in this patient. Routinely, it is of less than 160 degree. If it is obtuse, then there is a clubbing present. Clubbing is present in different particular systems. Like in respiratory, there are different causes. In cardiac, there are different causes. In GIT, different causes. So clubbing will show you that patient may have some diseases in that patient. Then the cyanosis. Cyanosis is again of 2 types: the central cyanosis and the peripheral cyanosis. So for that cyanosis, there is a bluish discoloration. Cyanosis is being seen at the tip of tongue, the hands. Baba, haath dikhao sir. So in particular, when there is a reduced hemoglobin is more than 5%, then your cyanosis will present in that patient. So by seeing this hands, by seeing tip of Baba ji, jeeb bahar dikhao, tip of your tongue, by nose, by ear lobules, you can see the cyanosis. Then come to the fifth part is a lymphadenopathy. For lymphadenopathy, we have to find out, we have to palpate the lymph nodes of that patient. If they are palpable or they are enlarged, then we call it as a lymphadenopathy. And there are again so many causes of lymphadenopathy. Whether there may be some infection, there may be some malignancy, there may be some leukemia. So in chronic diseases, you may have a lymphadenopathy. So there are few particular parts where we have to see the lymph nodes. So there are groups of lymph nodes: cervical lymph node, axillary lymph nodes, the abdominal lymph nodes, the pelvic lymph node. So always stand behind the patient, and then for that you have to see the groups of lymph nodes, whether they are palpable or not. If they are palpable, then again there is a lymphadenopathy is present. So in edema, there is a swelling in your lower limb, that is the pedal edema. But edema can be of generalized also. In that case, we used to call it generalized anasarca. In anasarca, the whole body will be swelling. But in general physical examination, if it is not generalized anasarca, then just look at the feet of that patient. And in feet, if there is a swelling present, then patient is having an edema. So that is only up to the shin of tibia you have to see. So in pitting edema, once you are pressing your thumb, there will be a depression in that shin of tibia. So this is edema. So these all 6 things: pala, icterus, cyanosis, conjunctiva, clubbing, and the lymphadenopathy and edema. These are the common thing to see in the general physical examination.